FD.
Okay. Oral cavity and salivary gland. First part of the lecture, our presentation is about the oral cavity. Oral cavity, this form a passage from the lips to the oropharynx. It is largely filled by the tongue and teeth and is lined by a mucous membrane. The parotid gland open on its lateral wall and the submandibular and sublingual glands open to its floor. Here, the roof is formed by the hard palate anteriorly and the soft palate posteriorly. The soft palate is a mobile flap that hangs posterior and inferior at the rest, separating the oro from the nasopharynx. This is the soft palate which separates the nasopharynx from the oropharynx. Separate the nasopharynx from the oropharynx. Two muscles insert in the soft palate from the lateral wall of the pharynx, which are the tensor villi palatini and the levator villi palatini. These elevate the soft palate during swallowing to prevent reflux into the nose. The uvula hang from the middle of the soft palate, and two pairs of muscle, which are the palatoglossus and the palatopharyngeus muscle, form the anterior and the posterior fosses in which the palatine tonsil lie. This is the hard palate, soft palate, median raphe, the uvula. This is the palatoglossus muscle and palatopharyngeus muscle in which the palatine tonsil lies between. The muscle of the tongue form two groups. The intrinsic muscle are a group of four muscular bands in the tongue. They are entirely within the tongue with no external attachment. They act to alter the shape of the tongue. The four muscles are superior longitudinal, inferior longitudinal, transverse muscle, and vertical muscle. These are the intrinsic muscle of the tongue, superior longitudinal, inferior longitudinal, vertical, transverse muscles. And this is the septum, which divides the tongue into two halves. The extrinsic muscle of the tongue, which we will describe it in details, are a group of four muscles. They are all arise outside the tongue. They act to alter the position of the tongue. The four muscles are genioglossus muscle, hyoglossus muscle, styloglossus muscle, and palatoglossus muscle. The genioglossus muscle arise from the inner surface of the symphysis menti at the superior mental spine of the mandible and insert into the ventral surface of the tongue. Inferior fibers of the genioglossus muscle insert into the hyoid bone. The second muscle is the hyoglossus muscle, which arises from the hyoid bone and insert into the side of the tongue. Third muscle is the styloglossus muscle, which arises from the styloid bone and insert into the side of the tongue. And finally, the genioglossus muscle, here, genioglossus, hyoglossus, and the styloglossus. Now we describe the floor of the mouth. The floor of the mouth is formed by other muscles that also support the tongue. The most important is the mylohyoid muscle, which is slung from the mylohyoid line on the inner surface of the mandible to the hyoid bone on either side. Now this is the mylohyoid muscle. This origin from the mylohyoid line of the mandible and inserted into the body of the hyoid bone. And this is the geniohyoid muscle, which origin from the inferior mental spine of the mandible and inserted into the body of the hyoid bone. As we described before, this is the geniohyoid muscle arises from the inferior mental spine of the mandible, while the genioglossus muscle arises from the superior mental spine of the mandible. So the genioglossus muscle lies above the geniohyoid muscle. Inferior fibers of genioglossus muscle pass from the hyoid bone and insert into the symphysis above the mylohyoid muscle, while the anterior belly of digastric muscle pass from the hyoid bone and insert into the symphysis behind the mylohyoid muscle. So this is the genioglossus muscle above the mylohyoid muscle, while the anterior belly of digastric muscle lies below the mylohyoid muscle. The stylohyoid muscle lies lateral, passing from the styloid process to the hyoid bone. Lymphatic drainage of the oral cavity is to the submental and submandibular nodes and to the retropharyngeal and the deep cervical nodes. Now, we will take the tongue and its muscles and describe it again in the 3D image. Now, this is the tongue. First, we hide the mandible for better view. This is the tongue with its intensors muscle, and this is the rest, the extensor of muscle and the floor of the mouth. First, we begin with the Palatoglossus muscle, which arise from the soft palate and insert into the posterolateral surface of the tongue. Then the hyoglossus muscle, which arise from the hyoid bone and insert into the side of the tongue. Then the styloglossus muscle, which arise from the styloid process and insert into the side of the tongue. This is the genioglossus muscle, which arises from the inner surface of the symphysis menti at the superior spine of the mandible and insert into the ventral surface of the tongue. Inferior fibers of genioglossus muscle is not shown here. And this is the geniohyoid muscle, which arises from the symphysis menti and insert into the body of hyoid bone. Now we return to our presentation. Radiology of the oral cavity. Because the oral cavity is amenable to direct vision, radiological assessment is not often required.
انهي هذا انهي ورجع على الدكتور دعاء.
يطلع شلون انهي؟
سوي ستوب شير هذا.
ذاك بدي يبقى بس لحظة. شلون اروح؟
على
اوكي هسه طلعت الصورة يمكن برزنتيشن؟
لا برزنتيشن ما طلعت.
Radiology of the oral cavity. Because the oral cavity is amenable to direct vision, radiological assessment is not often required. However, in the case of infiltrating pathology such as tumor cross-sectional imaging, using CT or MRI is very useful. The hard and soft palate, palatine fossa, and extrinsic muscle of the tongue may be identified using both CT and MRI, as may the maxilla, mandible, hyoid bone, and surrounding structure. MRI is better soft tissue contrast than CT. In mandible or dental amalgam, MRI image are superior to CT in this area. This is a mesogeital MRI through the tongue and oral cavity. Number one is hard palate. Number two is soft palate. This is the intrinsic muscle of the tongue. This is the lingual septum. This is the genioglossus muscle. This is the mylohyoid muscle, which form the floor of the oral cavity. This is the hyoid bone. And finally, this is the mandible. Now we go to the second part of our presentation, the salivary gland. These exocrine glands are situated symmetrically around the oral cavity and produce saliva. This is the largest of the salivary gland and lies behind the angle of the jaw in front of the ear. It is molded against the adjacent bones and muscles. The glands has a small deep part and a larger superficial part. Both of them are continuous around the ramus of the mandible via the isthmus. Now, as we see here, the parotid gland is divided into two parts by the facial nerve. The deep part of parotid gland extends medially to the carotid sheath and lateral wall of the pharynx, separated from them by styloid process and muscles. The superficial part of the parotid gland lies anterior to the tragus of the ear and is molded to the mastoid. Where is here? Molded to the mastoid process and sternocleidomastoid posterior and to the posterior ramus of the mandible, and masseter anteriorly. The parotid gland has anterior and inferior or tail, which wraps around the angle of the mandible. The terminal part, where is the pointer? The terminal part of the external carotid artery runs through the isthmus, divided into two terminal branches, the superficial temporal artery and maxillary branches. With the confluence of the veins of the same name, which I mean the superficial, means the superficial temporal vein and maxillary vein, they unit to form the retromaxillary vein. The retromaxillary vein lies just superficial to the artery. The facial nerve, having emerged from the stylomastoid foramen, ran through the deep part of the gland via the isthmus to the superficial part within which it branched into 5 terminal divisions. This diagram, this photo showing the facial nerve division inside the parotid gland, showing the temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and finally cervical branch. The facial nerve lies superficial to the internal carotid artery and retromandibular vein in the isthmus. The parotid duct, Stenson duct, began as the confluence of two ducts in the superficial part of the gland and runs anteriorly deep to the gland. It arches over the masseter muscle before turning medially to pierce the buccinator and drain into the mouth opposite to the second upper molar. The duct is approximately 5 centimeters long. Small accessory parotid glands are common, 20% joining the parotid duct along its length. This is the parotid duct, which cross over the masseter muscle and then pierce the buccinator muscle and open opposite to the second upper molar tooth. And this is the accessory parotid gland, which open along the parotid duct. The submandibular gland. This gland lies in the floor of the mouth medial to the angle of the mandible. It is a mixed mucinous and serous gland, so it has a tendency to form calculi. It has a lower superficial lobe continuous with a smaller deep lobe above and around the posterior border of the mylohyoid muscle. So the submandibular gland is divided into superficial and deep lobe by the mylohyoid muscle. The Watson duct is above 5 centimeters long and comes as the confluence of several ducts in the superficial lower lobe. From here, it's run superiorly through the deep upper lobe before running forward to open in the mouth at the side of the frenulum of the tongue. Here's an X-ray showing left submandibular gland stone. And here's an ultrasound of left submandibular gland showing a stone measuring 9 millimeters in the mid portion of the left Watson duct. The sublingual gland. This gland lies submucously just anterior to the deep lobe of the submandibular gland and drained via several ducts up to 20 directly into the floor of the mouth. Posterior, they are posterior to the opening of the submandibular gland. This is the opening of the submandibular gland, and this is opening of the sublingual gland, which lies posterior to it. Some of its ducts may unite and join the submandibular gland duct. Now we go. Share. See 3D image of the salivary gland. This is the parotid gland, which lies behind the angle of the jaw. This is the parotid duct, which opens opposite to the second upper molar tooth. Now hide the mandible. This is the submandibular gland, which lies on the floor of the tongue, medial to the angle of the jaw. And this is the submandibular duct, which open at the side, at the frenulum of the tongue. And this is the sublingual gland, which open directly into the tongue. You sure? Now return to our presentation. Radiology of the salivary gland. Cylography. The ducts of the parotid and submandibular glands may be cannulated and injected with the radio-opaque contrast to outline the ductal system. The ducts of the parotid gland arch around the mandible because of the way in which the gland is molded to the adjacent structures. The parotid duct is seen on the lateral view. The submandibular gland and the duct system may be seen on lateral projection. The ducts of sublingual gland are not amenable to canalization. This is a cylography of the left parotid gland. As we see, the parotid gland is seen behind the angle of the jaw. Number one is cannula in the parotid orifice. This is a parotid duct This is secondary dactyls, and this continuous radio-opaque line is a contrast on the surface of the tongue. This is condylar process of the mandible, and finally the angle of the mandible. CT and MRI. CT and MRI are of particular value for tumor of the glands to assess involvement of the surrounding structures. CT may be performed after cylography to improve visualization of the ducts. MRI image may demonstrate the facial nerve within the parotid gland. The ducts are best seen if dilated by obstruction. This is an axial MRI view through the parotid gland. Number one is the medial pterygoid muscle. Number two is the ramus of the mandible. Number three is the masseter muscle. These muscles are described before in the previous lecture of mandible. And number four is internal carotid artery. Number five are internal jugular vein. Number six is parotid gland. Number seven is external carotid artery. Number eight is mastoid process. Number nine is tenoclidomastoid. Ultrasound. This may be performed through the skin or intraorally with high-frequency transducer. This is ultrasound of the parotid gland showing acute parotitis due to mumps. Now we go to quiz. Any question?
عايشة ايدك دكتورة دعاء على very nice and impressive lectures. إذا ما عندكم سؤال حتى نروح على الكويز. ماكو سؤال توكلي. نختار
We skip number one because the number one is not clear. Start from number two.
Okay. نور محمد جواد. سالي عبد الرضا.
Submandibular duct.
Submandibular هاي.
And this lies medial to the angle of the jaw. So it is submandibular gland.
Okay. Submandibular duct. لها اسم دكتورة سالي شنو يسموها؟ هاي ducts.
Wharton duct.
Wharton duct. Okay. دعاء سعد.
Ductules.
Secondary ductules.
Secondary ductules.
Okay. عقيل رقم 4.
High start contrast on the surface of the tongue.
صحيح. 5 أحمد خليل.
أستاذ head of the mandible أو نسميها condylar process.
Excellent. Number 6 Gazan.
Coronoid process of the mandible.
Coronoid process of the mandible. Number 7 هبة.
نعم أستاذ. Mandibular notch.
Mandibular, excellent. عندك بعد؟
بعد واحد الثاني. هذا.
يلا أستاذ محمد.
نعم يا أستاذ رعد. رقم 1 لارا نصير.
نعم دكتور. 1 heart palate.
heart palate. زين. رقم 2 شيماء علاء.
نعم أستاذ soft palate.
soft رقم 3 علي حسين مصطفى.
نعم أستاذ. Intrinsic muscles of the tongue.
رقم 4 زهراء صباح.
نعم. lingual septum.
رقم 5 صفا شامل.
نعم أستاذ. Genioglossus muscle.
رقم 6 رنين.
نعم. 6 مايلوهايويد muscle.
زين. رقم 7 نور بابا.
نعم أستاذ. هايد بون.
هاي الضوء. ومحمد فرحان رقم 8.
نعم أستاذ. mandible.
mandible.